So let's take a look at our symptoms. So this client is going to have this dark brown vaginal bleeding. And remember that star point. This is classic for a molar pregnancy. She's going to have excessive nausea, and that's from that rising beta HCG levels. They go crazy here and rise sky high, and it makes her feel so pregnant and so sick. But they can get hyperemesis gravidarum, and that's where they just cannot keep anything down. They throw up constantly, and even their electrolytes can get out of balance, which is very dangerous. And again, that's from those rising beta HCG levels. And that fundal height is going to grow larger than expected. Remember this star point. This is also very classic for molar pregnancy. Remember that uterus is filling with those grape-like vesicles. So you might have a client who thinks she's 16 weeks pregnant, but her uterus is measuring up at 24 weeks pregnant. It's just a lot larger than it should be. And then preeclampsia occurring before 24 weeks gestation is pretty classic. And remember, preeclampsia is going to be that proteinuria and elevated blood pressures. All right, so how do we treat this? We have to evacuate that uterus ASAP, and that's going to be with a vacuum aspiration and curettage. We have to get these contents out. On the NCLEX, do not give any uterine stimulants like oxytocin before we've evacuated the uterus. It could cause one of those vesicles to be released and cause an emboli. So we will not be inducing labor for this client. Remember, we're removing it by vacuum aspiration and curettage. After the uterus has been evacuated, we will give uterine stimulants like oxytocin, and that's going to help clamp down that uterus and stop the bleeding. Okay, so some of our treatment and teaching here. We're going to be monitoring for gestational trophoblastic neoplasia or cancer. So to do that, remember this star point, we're going to be tracking those beta HCG levels, and it can be for up to 1 year. Rising beta HCG levels mean we have possible cancer. If that happens, then we're going to treat with methotrexate. Now, make sure you teach the client no pregnancy. We're going to be using oral contraceptives to prevent pregnancy during this follow-up period. No IUDs. That's going to increase the risk for uterine injury.